does the adage still hold true that prevention is still the best cure? And what is the simplest way for people to look at this in terms of prevention?
Well, as a public health person, I completely agree. I mean, the investments, the time, the energy, the ideas have to go into prevention. I was just saying earlier, this idea of releasing calamity funds to local governments or local areas that have outbreaks is actually inverted. We should actually be releasing the funds prior to the outbreak. So we do know that this is here too, and therefore the investments need to go into cleaning. What happens is we are rewarding local governments for outbreaks. They have an outbreak, then
we give them
yeah. So
money.
it's like you're trying to catch those are falling off the cliff, when actually what you need to do is to build a fence around the cliff so that people don't fall off. Now, good epidemiology is still the backbone of public health. So when you pick up 1 or 2 cases, 3 cases, 4 cases in an area, you've just got to do extraordinary measures to control the vector. Can you control it completely? Absolutely not. But you can reduce the risk. And so the numbers that we're seeing now come from the inability to prepare for what should have been a predicted outbreak. It was the same with measles. We knew the numbers were
India
down.
a while ago, 1 or 2 cases, they have massive intervention. Is that the case?
In Kolkata, if they have 1 or 2 cases, then they start the focus to clean up there. They focus on the destruction of the larva there, and they try to make sure that you break the mode of transmission.
How do you do that? How do you destroy the larva?
Fumigation is their
Well,
way, right?
fumigation will destroy your adults, the ones that are flying.
But
Okay?
the larvae?
The larvae are in water, and they are in clean water. So actually, if you put, sometimes you put salt,
Soap,
or you
yes.
put
Or soap.
or you put
Yeah.
vinegar,
Clorox. Yeah.
or you
Soap
put
lang.
oil
Yeah.
in clean water, the mosquitoes
won't
will
go
not
there.
breed there.
Yeah. Yes.
So we just need to really do that and make sure, particularly I think for the Philippines in schools, because this is a daytime biter. And the kids are in school during the day. So I think the education sector has a big role to play in prevention of future outbreaks. But we have to front load the funding and the intervention. Don't do it after. This is just catching people falling off the cliff.
Apart from Kolkata, can you think of any other country, maybe somewhere in Southeast Asia, that is responding well to this threat? Like maybe Singapore or
Indonesia,
one of the
perhaps?
Southeast Asian countries? Is there a model that we can...
Well, Thailand is also doing what it can in terms of community cleanup measures, and they're really good. They're really good at that, but their numbers are still high. So, we're up against a vector-borne disease. You've got to control the vector, and you just have to destroy it where you can.
But of course, with all due respect,
Sure.
we've been doing that. We've been fumigating.
That's
We've
right.
been throwing away
We've
water.
taught people time and again
Yeah,
to
but-
please cover your baldes, to
don't
make
leave
sure
water
that
standing.
you
We've
even
been wearing
get rid of your
pajamas.
bromeliads where water
Exactly.
usually
Exactly.
gets
How
about stagnant. Part of the preventive is even telling our boys and girls to wear something bright,
And to use
not
repellents.
dark,
Use repellents.
use repellent. So in other words, we've done as much as we can, to prevent an outbreak, but it keeps happening.
Well,
So
yeah.
I guess the question is,
but
is there a better way?
Well, that's the thing, right? The virus tends to resurge every 2 years. Why? We don't know. Every 2 years, we expect it to
So next
multiply.
year, wala.
Yeah.
Oh, really? Okay.
Yes. So count 2 years from now, and then we know that you'll really have
really?
hotspots. Yes.
Wow. Okay.
Yes. So that's why I was saying
That's fair warning. We should
the
prevent.
the
I mean,
epidemiology is a very important part of the intervention. The moment you see 1 or 2, in Calcutta, they're monitoring the hospitals. Any reported case of dengue, they trace where does that patient live,
To nip it in
and then
the
they
bud.
clean up in the.
Yeah.
I mean, it's a lot of work, but right now that's all we have.
Direct
Yun na.
intervention talaga. Direct
Yeah.
intervention.
You have to destroy the vector.